Welcome, everybody. So glad you could join us today for our unusually scheduled monthly webinar. This month, we postponed it to ensure that we would have all of the information we needed to give you the best information that we can about the Healthcare Commission's decision process. Joining us today, we're very lucky to have two of the employer commissioners who are serving all of us on the Commission on Public School Employee Health Benefits, that of course being the commission that was set up a couple of years ago to negotiate healthcare benefits for all school employees statewide, all public school employees statewide. We have with us today Elizabeth Fitzgerald, who serves as chair of the employer commissioners, and Mark Koenig, who is an alternate, but has been sticking close by with all of the activity that is come down from the commission's work. And Carrie, if we can go, well, we'll go to slide one. Mark is going to start us off, and Elizabeth, feel free to jump in with comments anytime, of course. Also, to those of you who are attending, please do use the chat for your questions. We'll be monitoring that and we'll ask those as they come up without, of course, interrupting everybody who's speaking. So with that, let's get started. Mark Koenig, it's on you.
Okay. So as most of you are probably aware, a few years ago, the state legislature passed a new law requiring all healthcare benefits for K through 12 to be handled as a single negotiation in an attempt to contain costs. And so this is the end of the second round of bargaining. This will be a decision that will go from, and correct me if I'm wrong, Elizabeth, 23 through the end of 25. We started formal negotiations in April, as is required by statute. Although we did start discussing this back in January of this year because there was proposed changes to the law. So there were hearings held January, February to discuss potential changes. Some went in, some did not. But we began actually bargaining the entire commission back in April. We held a 3-day facilitated negotiation as an attempt to reach common ground, which in some cases we did, in some cases we didn't. Got a few things settled between all of the commissioners. We had a 2-day mediation where we had a little bit more of agreement, but some of the main issues regarding mostly money were still on the table. Then we went to fact finding. Both sides put forward their case to the fact finder. He wrote up a very detailed and actually well thought out analysis of the issues and presented what he thought was the best result that could be had. After that, we had a second round of mediation, just a 1 day to see if we could come to agreement on a couple of outstanding issues. We did not. And then last best offers were presented to an arbitration panel. We held a week of arbitration hearings, and that panel handed down its decision earlier this month. So that's kind of the logistics, and we can go into details now. So starting back in April, there were two very distinct sides to how especially premiums and out-of-pocket should be handled. The NEA was trying to tie it to salary bands and sliding scales, and we were trying, the employers, school boards were trying to keep it as it kind of structurally is now, but changing the balance of how much each side was responsible for. Currently, teachers, licensed employees have a 20% share, and we have the school boards pay 80% for non-licensed or sports staff. It's sometimes 20%, but the collectively currently is about 16% on average across the state. And I know I'm not doing goals, but I'll get there. we were hoping to get that up to a closer to a 20/80 split. So those were the two main sides. We did have some goals. We were trying to collectively, as you can see, get the costs that the community could support, the taxpayers, the parents, the children, and the teachers. Make sure that the entire community was able to deal with this benefit. The nice thing about having a statewide negotiation is that the benefit is the same throughout the state. So in terms of competition between districts, we aren't after each other because somebody's healthcare benefits are better in one part of the state than the other. We are on a level playing field throughout Vermont. We were looking for more equitable cost sharing. It has been more and more placed on taxpayers and less on employees over the past decade or so. We were looking for something that's going to be easy to administer. As many of you remember, a couple of years ago, our third-party administrator kind of imploded and caused many problems for every district. That has been rectified, but that was the fault of no one, but a problem for everyone. At least no one's fault who's sitting in this room. And we wanted to make sure that information was readily available to both school districts and employees so they can make the best choices possible with the benefits offered, because there are different tiers. So next slide. So we started out bargaining. We had 5 major issues that we want to talk about. So premium share, as I was saying earlier, out-of-pocket expenses, mostly covered by HRAs. We wanted to talk about eligibility, how many hours a week one would work before they could attain the benefit. We wanted to have a grievance process in place because this was a statewide negotiation, so it should be a statewide grievance. Locals shouldn't have to try and figure out the details of something that they had no involvement in during the negotiation process. And then cash in lieu. One of the things that got changed this past legislative session was that the idea of double dipping, if spouses are working for different districts or even the same district, they couldn't get cash in lieu if one of them decided not to take benefits. We were hoping to standardize cash in lieu across the state so that it wasn't different levels of cash in lieu in different districts, because it's anywhere from $0 to $10,000 across Vermont. Next. So we had, in terms of the agreement, we agreed to early. Both sides of the commission wanted a 3-year decision or agreement. Now, through the awards, the AV value, one of the terms that is after Obamacare came into effect, to understand different types of insurance, healthcare insurance policies, they came up with a formula, which is the AV, to determine how they stack up against each other. So you can kind of get an apples to apples, even if the plans themselves seem quite different. And the higher percentage means the less that the employee or the user is paying. So the awards that we have now within the state for public teachers or public education, that's where I want, is 97 and 98% is covered by the districts, 3 to 2% is covered by the employee. State employees are at an AV of 95. So that gives you an idea of where we are. We could not find benefits that were really that much different or better in the state or even across the country. So this is a very rich, very excellent benefit for our excuse me, for our employees. And although there is, and some of you, if you're in your negotiations for your locals, you're hearing that wages are not keeping up with this benefit, and so you need to have higher wages to compensate for the increase in premiums and out of pocket. We do have a link here to the Campaign for Vermont wage report, which even as they were writing it, you'll see in their introduction, they were surprised to find out that that is not true. Wages are doing fine. Their study for education employees. So that's something you might want to keep in mind during your negotiations, is that you don't have to greatly increase wages to somehow compensate for the benefits. And we are not seeing necessarily that there is any issue regarding teachers or staff leaving because of healthcare. So there are issues regarding keeping people employed, but it's not because of any healthcare benefit that we can see. Next. So we laid out an idea of the premium history. Just wanted to, back in 2017, we were still under VHP before the change. And the idea of changing over to the silver, gold, and platinum was to control premium costs. And as you can see, from 2017 to 2018, there was a significant drop, and it did its job. We have just this past year crossed with inflation back up to where the cost would have been in 2017. The bottom line there is showing, had we stayed with VHP and trended at 5.5% increase year over year, which is a very conservative number because we all know it's been double digits, the number would be closer to $1,000 for a single monthly, as opposed to $800 as it is now. So the idea of going into the new system actually did do what we all hoped it would do. Next. So this is the confusing slide. It's got about everything you can, and believe it or not, this is simplified. So it is hard to follow. It is a lot of numbers. There are a lot of different moving parts within what seems like should be an easy discussion. But on the left, we have where we are right now, what is going on with the past award, and the right is what was just awarded by the arbitration panel. So you can see we are still licensed 80/20 for the premium share. That does not change. This current year is a freeze for the non-licensed. So they are still at an average of 84/16. As of January 1st, there's a 2% increase, not to exceed 20%. So that average should go to 82/18. The following year, in 23, 24, and 25, there will be a 1% increase each year over the course of that new award, not to exceed 20%. So that should move us up slowly, but we do still have districts in the state that are down in the single digits for what their non-licensed pay. So it's not going to get us all to 20%, but the vast majority should be in the 18 to 20%. So in broad terms, we should be at pretty close to 80/20 across the board by the end of 2025.
Mark, if I can stop you here, we do have
You
a
may.
question.
Go ahead.
The question is, who is that wage report that you referenced from, and what is their affiliation, or do they have an agenda?
They are a think tank, as far as I know. They're a kind of non-partisan. I was curious of that too when I first saw it. If we can go back to that slide, it is just the name there. One more, I think. There. So Campaign for Vermont is the name of the organization. It is a number of past political people within Vermont from both sides of the aisle. And they just occasionally take up an issue that they think it needs more in-depth detail, and they will put together information. So they just did a wage report across the state and crunched numbers. So there's not really any politics or policies. It's simply numbers. So you can look up Campaign for Vermont and you should be able to find them. So forward a couple, please. There we go. So we are out of pocket. So out of pocket is not, it's what's going to be covered by anything beyond the premium. To be clear, the premium coverage does handle all wellness visits. It handles a lot of standard medications, so insulin or asthma inhalers, high blood pressure, high cholesterol, all those kind of medications are covered under the premium. It does not even touch the HRA. Because of the third-party issue a couple of years ago, everybody switched to employee last dollar. So all employers cover first dollar out-of-pocket expense up to their limit, and then the employees cover last dollar, and then once the limit is hit, then the insurance company covers anything beyond that. So currently, the employer covers for a gold CDHP $2,100 for a single, $4,200 for all other tiers. Then the license or a licensed employee would cover the next 400 or 800, depending on their policy number. And after that, everything else is covered by the insurance company, by VHI. The shift was in the arbitration. It will now be $1,900, 600 employees. So there is a small shift, but that stays static for all 3 years. There is no other shift. And the non-licensed don't change at all. The eligibility does not change. It's still 17.5 hours minimum to get full benefits. Cash in lieu is only going to follow the double dipping issue that was set out in statute. There is not going to be some sort of cap imposed. And there is a basic statewide grievance process. So if any of your employers or employees have questions, concerns, problems, then there is a process for you to contact the commission and try and get an answer. Either the commission will answer it or will take it to arbitration for you. But it's not something that you would handle individually within your local districts. Next. Is this where we wanted to switch, Elizabeth, or am I still going?
Why don't you cover this and then we can switch right after this. Perfect.
All right, so HSA, there is the options. We talked about HRAs, which is what the vast majority of the employees have. If they have a silver CDHP, they do have the option to take an HSA. The difference being that the money put into an HSA belongs to the employee, whereas the money going to an HRA belongs to the employer. At the end of the year, anything not used goes back to the employer. Anything not used in an HSA stays with the employee. And the contributions are, as you see there, the same contributions that we put in for an HRA. And that's where it is.
Thanks, Mark. So I'm going to switch a little bit because one of the big financial issues that went into last best offer was around the out-of-pocket cost share. I'm going to spend a little bit more time on that in this session, and then we can open up for more questions. So I think, as you all know, most employees are selecting an HRA right now. We feel with the single option of an HSA on the silver plan only, that will continue over the next 3 years, largely in part because the employer exposure is almost 50% of that total out-of-pocket expense on the silver. If you recall, the out-of-pocket exposure in aggregate on the silver plan is $4,000 for licensed. I'm sorry, it's $4,000 on the single plans and $8,000 on the other 3 plans, whereas on the gold CDHP plan, it's $2,500 and $5,000. So with that application of the equivalent of HRA dollars, it's a pretty significant, $2,100 expense for exposure for the employee on the license, by way of example. So the HRA, I'll spend most of my time talking about HRA and out-of-pocket. HRAs are not prorated. They're available immediately in any given benefit year. And what I'm going to cover here is really the maximum potential employee last dollar exposure for that full benefit year. So for each of the 3 years, again, as Mark said, our proposal had some modest increases in years 2 and 3 for licensed, and in year 3 for non-licensed on the out-of-pocket. But what you see here is that maximum last dollar exposure in each of the years is for licensed, it's $600 for single and $1,000 for all other tiers. And then for all other employees, it's $300 and $600, which is not different than it has been in the first award. And there was testimony taken in arbitration that more than 70% of employees will not incur any out-of-pocket costs based on recent claims history. So that's a significant coverage by the employer and ultimately by the plan. One other point that we wanted to make here is 100% of the deductible. Many folks are used to plans that have a deductible that the employer or employee or consumer are accountable for. But in this decision by the arbitration panel, 100% of the deductible is paid out of the employer HRA, and that includes both the medical and the pharmaceutical side. That deductible, by way of, if you recall, is about $1,800. So with the $1,900 HRA on a single plan, that is fully covered. With the HRA, and this kind of gets back to the actuarial values that Mark was talking about earlier, the investment that an employer is making in a single plan is about $10,000. And the investment in a family plan is about $26,000, which is a significant investment in employees and in total compensation, and honestly is substantially more than we spend on equalized per pupil spending in the state. So this is a really excellent benefit. And as Mark said, we were not able to find any comparable plan that covered this amount of out-of-pocket investment by the employer for the employee's behalf. If you switch to slide 10,
Actually,
Carrie?
Elizabeth, may I interrupt you with a question?
Absolutely.
Or would you like me to hold on to it?
No, go ahead.
Okay, so we have somebody asking the following. A number of employees in our district expressed concern about the rising cost of non-licensed employees. Can you explain the thinking behind the push to reach 80-20 for non-licensed employees, given the relatively large differences between their income and that of their licensed coworkers?
Yeah, good. That's a great question. Thank you for whoever asked that. Sorry, I can't see the chat room while I'm looking at the slides. A lot of the rationale went back to the original formation of the commission, in that there was an effort by the governor's office and we believed at the time by the legislature to really look at standardizing the benefit. The cost of the benefit itself does not change regardless of anyone's income. The value of that benefit is the same. As I mentioned, it's a $10,000 investment for single employees and $26,000 for family employees. So some of that dates back to the origin of the commission, where there was an effort to standardize. One of our key benchmarks was the Vermont State Employees Association, and every employee premium shares at 80-20 in that organization, that collective bargaining unit, or actually they have a variety of collective bargaining units. So that was one of our more significant comparable benchmarks. So that was one of the big drivers. And in the first round of bargaining, we found that I think Mark mentioned this, the average premium share with non-licensed employees was a little bit north of 16%. And in the first round of bargaining, the first round is going to end at the end of 2022, and that will be a little bit north of 18%. So it was a really relatively small jump over 3 years to sort of directionally move to the 20% from a premium share for a benefit that really costs the same for taxpayers and for the employers to deliver. So that was, and is a part of total compensation. That was a lot of the rationale that drove some of that decision making. And the arbitration award really reflects that directional move as well. What it really, I think the arbitration panel and maybe the fact finder basically said, acknowledge that directionally there should be some movement toward that standardization and just paced it at a little bit slower. So by the, if you look at the, like I said, at the end of 2022, the first award, the median or average will be north of 18%. So at 1% per year for employees, the average is going to reach that 20% by year 2 of this next award. So that's a relatively slow pace. And then I think when you look at the out-of-pocket exposure, you'll see that there's a fair amount of offset, as well as some of the savings that went into the shift to the metal-based plans. There were savings in the premium because there was very little change to that premium share over that 4-year period until there was kind of a leveling out that happened. So on balance, that was some of the rationale that went into the discussion throughout the whole process. I hope that answers the question. I'll go ahead on to slide 10.
There is actually a follow-up
Okay.
from the same person. Is there an implicit assumption that districts will increase wages to compensate for that rising share of non-licensed employees? And I think that goes back to something Mark was saying earlier.
Yeah, I think that's going to be up to districts. It's the healthcare and wages have now been separated in terms of what's negotiated locally, and I think the challenge has been, is it implicit that wages should fully offset increasing costs of healthcare? That's a question I think that is negotiated locally. If in fact it is, but I hope this presentation will also, share some information for those folks that find themselves going into local bargaining that kind of says, what is the real incremental cost? And then again, negotiating at the state level, given the goal that there was an effort to realize some cost containment, but also to standardize the benefits to some degree across the state, or at least directionally get there. The issue there is there were going to be some people, some districts that are going to fall below that average. So that is an area that I think it will be up to locals to make those decisions at the bargaining table. All right, shall we move forward here?
Yes, please.
All right, thank you. So we'll go to slide 10, and one of the areas that I know the employer commissioners really testified significantly during fact finding and in last best offer is the utilization of an FSA account, which is offered, I believe, across all districts. To put aside on a monthly basis pre-tax dollars for potential out-of-pocket liabilities or commitments. And what we wanted to show here is really what the impact would be on an average pre-tax savings of about 30%. So that $600 of last dollar out-of-pocket really goes to about $420. Compared to the 600, and then the 1,000 goes to about 700 unlicensed, and then you can see the impact on all other employees or non-licensed with the FSA. So we're hoping, and we'd certainly encourage HR departments and business offices to encourage those employees who make that choice to sort of leverage that the pre-tax savings associated with managing any of the out-of-pocket expense. There is some rollover period with that. I don't know exactly what that is. I think it was extended longer than it has been in the past, but FSAs typically, you wouldn't want to put more into those on a benefit year basis than you'd expect to use. But given that the employee's out-of-pocket exposure is last dollar, there's some opportunity to better manage that as well. And again, those dollars are available immediately. if we can shift to future key dates. So because the bargaining will commence for 2026 and beyond in spring of 2024, we really just kind of have it out there that any legislative discussion that might look at improving the process or looking at the structure of the commission or looking at different representation on the commission, things like that really needs to happen over the next 2 legislative years. And then in fall of 2024, there will have to be a settled an agreement or an award no later than December. So we'd like to just keep those out for people that might want to provide feedback to us or the legislature or their communities as well, just in terms of input on the impact of these awards on local budgets, things like that. So I'm going to take a little bit deeper dive. I'm not going to go into all these slides that are going to show up next. And Carrie, if you wouldn't mind going to 13, unless there's questions. I'm sorry, I can't see those pop up. Oh,
Yeah, actually there
I
is
see
one. And that is, have you done a total universe comparison? Total premium plus OOP plus HSA contributions on employee side, total premium plus HSA, HRA contributions on employer side.
I'm not sure I know how to answer that. We did provide some numbers to the state. I think I think as one of the areas that I think there was an improvement in the second round of bargaining over the first round of bargaining is on the database itself. And this is, we know this is an incredible ask of your business offices, but we felt like we were a lot closer in the numbers in round 2 than we were in round 1. So I think what I would say is we're going to be asking business offices, again, kind of as we go along through this next period of time, to provide that information. And I'm only hesitating on responding on this. We can certainly dollarize the maximum liability. What we don't know is claims, and claims will lag benefit years by at least a 12-month period. We also understand from Blue Cross Blue Shield, a major provider, that there's a belief that there's pent-up claims due to COVID. We also believe with the first round of bargaining that we haven't seen the full impact yet of those employees who will qualify to be in the plan due to eligibility of 17.5 hours. We don't know that the staffing challenges that districts are having at a local level might impact the number of part-time employees that might be hired in the future to provide services to students, and that might increase eligibility for the healthcare benefit. We don't know which employees might, because they have access to all tiers now, if local bargaining in the past limited them to a single tier of coverage, those employees that might choose an additional tier of coverage. And then, as I said, the claims will impact the out-of-pocket liability. And we have heard a variety of mechanisms for budgeting the HRA liability. The reality is the liability is 100% of what the award is. So 1,900 for a single employee. I'm actually going to cover these in a minute here. I know some districts sort of look at some past claim experience being in the 60 to 65% utilization range and budget in the 70 to 85% range. And that does create an exposure of, if you're budgeting at 80%, a 20% liability, with the hope and frankly, the experience that 20% won't be fully realized, but some of it may, with some of the pent up claims that might be, or medical needs that Blue Cross Blue Shield kind of refers to. So that was a really long answer, sorry. There's a way to document, and I think we can document what the total liability would be. the in practice is going to fluctuate somewhat. And we're hoping to monitor that both through Blue Cross Blue Shield, through VHI, and through local business offices. All right, can I move on?
Yes, thank you.
All right, sorry, I please feel free to follow up directly, or there's a website you can leave emails at, and I'm happy to have any one-on-one conversations if I can further explain anything, or go to somebody who really can explain it. So we've talked about employer and employee maximum out-of-pocket exposure, but we wanted to talk a little bit about kind of who pays what when, because I think it was important as we were explaining our case and testifying and fact-finding and arbitration, kind of what our proposals were intended to do. We thought this is something a lot of boards don't get a lot of exposure to, and we believe it's pretty helpful. And again, I'm not going to go into all these slides. I had to put a lot in because we now have 3 different scenarios versus 2, in that with the arbitration award, licensed single is different than licensed all other, and then non-licensed is really a doubling for single versus all other plans. So if I could shift to, we can just go right to 15, I think. So for licensed employees, which are largely teachers and administrators, on a single plan, the HRA value is $1,900. But what this means is an employee needs to incur a minimum of $5,300 in claims in order to reach the out-of-pocket maximum of $2,500, and that would cause them to actually be liable for that $600 last dollar out-of-pocket exposure. And as Mark mentioned, with the transition to the metal level plans, there were a lot of coverages that were provided in the Affordable Care Act that used to be paid out of pocket with the old VHI dual option plans, kind of when you went to the doctor, when you went to a chiropractor, when you went to PT, things like that, there were copays. And with the metal level plans, there's a significant amount of preventative care and wellness prescriptions that are covered 100% by the plan. And arguably, you could say some of that's built into the premium, but because the premiums only kind of crossed that line last year, those are really areas where employees didn't incur any kind of copays at the point of service. On the out-of-pocket expense in this particular case, the employee would be paying 24%. That $600 is 24% of the last dollar out-of-pocket exposure. But based on that claims information, that's 11% of the claims to reach the level after which the plan would fully cover any claims. So again, some employees could reach this very quickly with a significant event or a chronic illness. But as we mentioned before, the data and testimony and arbitration suggests that over 70% will not reach any of that $600 or $1,000 out-of-pocket expense at all. But we really wanted to share sort of who pays what when. So Carrie, if you can switch to the next one here, 16. So the first area, and as I mentioned, the deductible is fully covered by the employer-funded HRA. So the $1,800 of the $1,900 HRA is covered up front by what the employer funds. And for every $10 incurred, the HR covers $10, or the HRA covers that. We're going to go through these pretty quickly. 17, please. So then the next $100 of that $1,900 covers the next amount. And on this $5,300, it's another 10%. And then VHI picks up $400. So it gives you the formula below. Again, for every $10 incurred, the HRA covers 2 and VHI covers 8. And that's what's referred to as coinsurance. You can go to the next slide. So then it takes you to the balance, and in that balance of the $5,300 of claims, This is where the VHI or the plan would cover $2,400 and the employee who has a $600 last dollar out-of-pocket exposure would cover the balance. So in this particular case, for every $10 incurred in claims, the employee covers 2, VHI covers 8, and that takes you up to the full co-insurance of the plan. So that gives you an idea of the 11% to hit this claims number. And then beyond that, and I don't know if it's on the next slide or not, beyond that, yeah, you can go ahead and go to that. Beyond the 5,300 in claims, the plan covers 100% in any given benefit year. So we wanted to kind of share sort of how claims impact who pays what when, and how the maximum out-of-pocket exposure links into the amount of claims that have to be incurred before the plan fully takes over. And we believe, actually, we know, I say it like it's, you know, we're not sure of it. This is a very healthy benefit, and, you know, we're proud to offer this to employees in the education field. We had hoped for a little bit more rebalancing, particularly since many districts shifted in the first arbitration award from first dollar employee liability of some amount to last dollar, which is largely not going to be incurred by most employees. So let's shift to the next one. I'm not going to spend a lot of times on these because it's the same formula that I went through. But if you look at all the other tiers, which are the parent-child, the 2-person, and the family tier for licensed employees, the HRA value is $4,000. And again, the employee needs to incur a minimum of $10,600 in claims to reach that maximum out-of-pocket of $5,000. The employer's covering $4,000, the employee's covering $1,000. And the reason this, I think many of you are used to the all other tiers being a doubling of the single, and the fact finder and the arbitration panel accepted a different level of HRA funding for the all other tiers. So that's why this is a little bit different than what you've seen in the past. So in this particular case, anyone on another tier other than single is paying 20% of out-of-pocket last dollar, and then 9% of the claims, which is a really significant benefit to those folks accessing the other tiers of coverage, both for licensed, and then you'll see for non-licensed as well. And that's the only slide I'll cover on this one, Carrie, just in the interest of time, because the formula kind of walks you through how those claims are paid. So if I can shift next to the licensed employees, it'll be slide 25, actually 26, we can go right to. Again, I can, the background of how the claims are paid and sort of who pays what when is behind this. But for non-licensed employees, the HRA value on a single plan is $2,200. And this is a doubling for the other 3 tiers, so that would be $4,400. And in this particular case, the employee would have a maximum last dollar exposure of 12% of the $2,500. So that's the $300, and then 6% of the claims before the plan covers 100% of that. So that's of the $5,300. So that, to me, is one of the significant values for non-licensed employees in really looking at what their exposure is, and then how local districts want to balance any other benefits, inclusive of wages, against the actual costs of the healthcare benefit. So I think I'll stop there, and I hope that was helpful information. We're certainly available, and there's a website that is on each of the slides at the beginning of this presentation that we're happy to take questions, comments, input. And there's also a fair amount of information available on the healthbargaining.org website that includes some educational videos as well. All right, I'll stop there. Thank you.
And while we're waiting for more questions, I'll also make sure everybody knows that VSBA is currently working on a follow-up presentation webinar to this program actually looking at the legal sides of this with Chris Leopold and Joe McNeil, who also is on the employer commissioner team. They'll be covering the technical side of this, the legal side, and what it means for insurance related questions. So it may not be wholly material for most board members, but please encourage your superintendents and particularly business managers to get in on that end of things. Are there any other questions? I'm not seeing any in the chat box. I know this is a lot to digest. I'm not seeing any additional questions. Any summation from Elizabeth or Mark?
I would just encourage people, if you have questions or if you go back and your business office or HR folks have questions, although the statewide grievance process is a little bit loose and technically doesn't go into effect until 2023, we're hopeful that people will, particularly since you folks were not responsible for negotiating, or your boards were not responsible for negotiating locally these benefits, that any questions, we're hopeful that you'll bubble up and we'll try to get resolved at the commission level, and can really focus on standardizing this statewide benefit. And we hope that it's pretty straightforward at this point. But again, we also will be looking to document what costs have been, and if there have to have been trade-offs at local budget time with any student programming issues or with any operational risks associated in local budgets because of the impact of healthcare benefits.
We do have a question. The first arbitration cost our district $1 million on average. What is the additional cost?
Yeah, I think it's going to vary by district. And again, I think I went through a lot of the reasons it could change, but I would just encourage you to look at the variables that we talked about, like the number of employees that are accessing the benefit, the shift between plans, and then the utilization. And those will be the primary drivers that will demonstrate increases to the plan. I would encourage all boards to sort of highlight that voters don't get to vote on this line item within the budget, but I'd encourage education of the community around this benefit, because it is significant support that taxpayers are providing for educational employees to provide this benefit.
But there really shouldn't be a major impact on your budgets this year. One of the big things that it hit my district as well was having to go to first dollar employee or employer paying, and that's already in place for all of us. So that's not going to be a transition this year. We also do have a slight rebalancing for HRAs, so it's going from $2,100 to $1,900. It's flat for all 3 years, so insurance or inflation is probably going to eat most of that up. But the reasons that many districts got hit so hard after the first award are already in place and didn't change in this next award. So while there will be some shifts because of just premiums going up across the board, it's not going to be the same kind of hit.
And I think boards are aware that the premium increase, which has not been approved by DFR yet, but typically is approved, is about 5% or 5.5% on the Gold CDHP plan, which is significantly lower because of healthy reserves in VHI than it has been in past years. Thank you. Bobby Joe says 5.2%. I don't know if everyone saw that.
Looks like we have a couple more questions coming in. Maybe not. Susan? Maybe we've lost Susan. All right, well,
I'm
thank
so
you. very-
sorry. I was chatting away and I was on mute. You'd think I'd
Yeah.
know by now. Thank you. So I want to thank Elizabeth and Mark both very much for joining us today and providing us with all of the information that is so important for boards to have handy as you're tightening up and finalizing your budgets for the year going forward and beyond. And being that we are in the middle of December, on behalf of VSBA, I would like very much to wish you all a very happy and healthy holiday season. Hope that you're able to spend some time with your families and take the deep breath that you all deserve. It's been a long slug. And certainly 2022 will be filled with additional opportunities and challenges. We, as always, ask that you take a moment when you log out of the webinar to fill out a very brief survey to provide us with some feedback. And again, I want to mention the additional webinar that will be happening sometime early in the year, late January, early February, probably, with the legal aspects of all of this information. So again, thank you and Happy New Year to everybody.
Thank you all.
Thank you, Susan.